Terrific panel, terrific group of responses. I think we had some true grit from each of the three responders that were really reflected reality in a local union situation, and fantastic perspectives from a variety of outlooks from sort of a broader view. Allison has given us a green light for a little bit of question and answer. We're going to run over our time just a little bit and have a shorter coffee break. But so I want to entertain anybody. Just raise your hand. If you could, when you speak, just identify yourself, the group that you're with, and direct your question to one of the panelists.
My question to Dave and maybe Mark as well. Mike Monahan from Local 103 here. The Cadillac tax 2018, the number is $27,500, correct? At 40%. So, Mark, I don't know what you guys' contribution was. We're at $13 an hour, as you know, Dave. And I don't see us hitting it. So I'm just curious, how many people are actually going to hit that Cadillac tax? It ties into the rhetoric that you hear from the Rush Limbaughs and stuff, and our guys are always talking about it. And I says, not worry about it, but I don't see us hitting it in the near future. Hopefully it does go away, like when you said. But we're at, I bet you we're down around 19,000 when you take out vision, hearing, our unemployed. It's on the aggregate. I think we could probably reduce ours down to 18,000. We're nowhere near 27.5.
All right, so a couple of pieces to that. The first is it's not based on your contribution rate.
I know
it's
that.
on the cost.
Yeah.
Okay, so you don't want to look at your contribution rate and figuring out whether the excise tax is going to affect you. The second thing, this is a general statement, and Karin and I were saying, I would encourage people to stop calling it the Cadillac tax, because it's really not a tax on a Cadillac plan. It's a tax on good benefits. Yep. And that's the tragedy of it. So someone decided it was a Cadillac tax, therefore it's acceptable and it's a good thing. It's a bad thing, because what we're finding, Mike, is that when we're actually doing the analytics on plans on whether they're going to hit it, we are finding plans that are going to hit it, and the typical plan that hits it is we're seeing it with some of the smaller municipalities in the Commonwealth, plans that cover lots of retirees. Because retiree costs are higher than actives. And so if you have a number of retirees in your plan, pre-65, so they're not on Medicare yet, so you're still eating all of that expense, those are the groups, older groups, that provide coverage for retirees. We're actually seeing a number of groups around the country that are at risk of being subject to the excise tax in that first year.
So
and that's even, you're saying, with the bump, because there's like an add-on to the threshold for pre-Medicare retirees.
So there's a couple of pieces.
And we don't know, I mean, that's a fixed number in the statute, but then the other age and gender adjustment for the makeup of the workforce covered by the plan, we don't have any guidance on that one, and that might help in some of these, because let's face it, plans with older workers in them cost more.
So Dave, to say, I hope it's not they do away with it. So, and it's, I'm proud of our health. We have retirees, as you know.
Yep.
And you sat in our trustees meetings many, many times. Have you found a plan that's as generous as Local 103's health?
You're pretty.
Boy, that's loaded.
103 is very unique.
So we have a plan, and you reminded us many times that I've never seen a plan like it. So if we're not hitting it, who the heck? I don't understand who's going to hit it. Municipalities are. So
let's get some
responses. Is this because of early
on
retirements, 30 and out type stuff?
I want to see what the plans.
Every single one of the municipal plans in the state of Connecticut is, if they haven't hit it now, will absolutely hit it by 2018. The plan that you have, brother, is the plan that we used to have in all of our shops around the country. It was no different. The plan that you have is what everybody in this room, it's what we used to have 15 years ago. And it wasn't a Cadillac, it was just good coverage. So, but it's really true, and this is part of the disconnect between some of the Taft-Hartley funds and the stuff that you guys deal with and the stuff that we have to deal with in the non-Taft-Hartley world, is that for the most part, decent health insurance plans are $2,200 a month for the family plan. That will take it, I mean, that's now. So, and we're feeling throughout the state of Connecticut it's like that, regardless of whether it's the public sector or the private sector. The problem is now is we're getting faced in negotiations with huge upfront deductibles. And in the state of Connecticut municipality, you have to go into an arbitration system, which is basically just, we call it the Keep Lawyers Rich Act. And this is a huge problem. So people are being faced with upfront deductibles of $4,000 to $8,000.
Holy moly.
And this is being proposed all over.
Sparks, did you want to?
My sense of it, and I will defer to David in terms of his knowledge, but my sense is that it's still so unclear what all the rules are going to be about how you calculate it that none of us really know the answer definitively. But what I suspect is that you and I and everybody else in the Taft-Hartley world will end up tailoring our plans. If it doesn't get done away with, we'll end up tailoring our plans so that we don't hit it. And that's not how we should be deciding what our coverage is going to be.
Okay. Oh, Jen.
Well, I can just confirm that just in the public sector, like in Boston, we've done the analysis out, even with the lowest inflation rate of like 4% a year, all the plans would hit the Cadillac tax. And the GIC does a little better, but does better.
Okay, let's get some more voices. Brother from the Teamsters.
Sure. I'm Steve Sullivan from Pressmen, local 3. Quick question. We're in the private sector, obviously, got many employees. We are going to bump up against this threshold in 2018, sorry. I guess, Karin, my question to you is, you talked a lot about repealing the so-called Cadillac tax in 2018, but kind of the way I view it is there's some teeth to that law, so what's, I guess, under the idea of repeal but replace, what's going to be offered in place of the Cadillac tax to reduce the cost of health care? Something with some teeth, I guess. Any ideas or any thoughts?
So I just mentioned, yes, that there's one Republican bill and some other chatter. The thing you have to be worried about on the downside of that is, gee, if they decided to do tax reform, they might go after the exclusion from income, which is even worse. I mean, that's what the excise tax was about, was tax amounts over the threshold, but it's still excludable from income. I'm not saying at this point that I know, I think I was trying to downplay the possibility of repeal because there's a big pay for it that would have ultimately, probably, because this is how they balance the books, if you will, on the Affordable Care Act because of the costing assumptions made about the excise tax. So what would replace it? From our perspective, quite frankly, it should have been more progressive taxation on higher income people. Again, I don't know how many times I've said to folks the AFL-CIO preferred the House bill, not the Senate bill, back in 2009.
Grant, can I add something to that?
Yeah, sure. But sure.
I'll be very quick. Just to be clear, the excise tax is not going to actually save systemic costs.
Of course not.
It's got nothing to do with saving costs. It's a complete bill of goods, right? Dolores laid out that the underlying cost drivers have nothing to do with whether or not we get taxed. And what will actually happen, as Mark described, is that we'll just tweak our plans and start loading up the costs on individuals, which is what it's really actually all about. So just to be really clear, that's not going to happen. And in terms of repeal,
Exactly.
look, it's one of the few places, exactly, that silly skin in the game ideology, right? In terms of repeal, hey, look, this is one of the things that the Republicans might actually join us on. So I think we should just figure out how to do it, right? They hate taxes. Let's get rid of this one.
Okay, we have time for one more question or comment. Joey, introduce yourself.
Hi, I'm Joey Mokos with Unite here in Boston, 26. Dolores, but I would ask other people the same question. If we had to come up with a short list of demands on providers, and then I think secondarily legislation, what would you suggest?
I think I would be very concerned about the consolidation of hospitals and of hospitals with physician practices. It's, you know, too much power in one or two places leads to increases. Sorry? What?
I just said partners.
Well, I didn't say it. It's a matter of enormous concern. And I also see no perception that hospitals have to reinvent themselves and think about how they're going to be 20 years from now. They've all grown bigger and bigger and bigger, and at the same time we're saying people shouldn't be in the hospital. It's not even good for their health. I mean, I wouldn't want to go into a hospital. The places are germ factories. And I speak from experience with friends who have in fact had exactly that happen to them. They've got to figure out how to downsize. I mean, everybody else in the entire country is downsizing and figuring out new ways to give the same or better service. In the case, every single case, mergers and consolidations, unlike every other industry in the world, the prices haven't gotten lower. There aren't any efficiencies that they have adopted to lower costs. So we've got to address that. Secondly, and I say this, my husband is a physician and 2 of my 3 children are. Doctors did not used to be rich. They are today. And all the really primary examples in this country of really good healthcare systems, doctors are on salary. They are not on fee-for-service. So you look at Kaiser Permanente in California, you look at Geisinger in central Pennsylvania. All of them have doctors who get a salary. I quickly say, none of my children are in private practice. They are all on salary. And you know what? They don't treat their patients like dirt. That's right. They treat their patients the way they would have treated them if it were still fee-for-service. So those are the 2 things I would say first.